If you are sitting on the toilet, pushing harder and harder, sweating, feeling pressure in your rectum, but nothing is coming out, stop for a moment. Because forcing it may be the worst thing you can do. When stool gets stuck in the rectum, it may not be simple constipation anymore. It can become hard, dry, painful, and in some cases, it can lead to bleeding, swelling, severe pain, or a dangerous blockage. In this video, I'll explain what is really happening inside your body, why stool gets stuck, what you can safely do at home, and the warning signs that mean you should get medical help right away. And please remember this: if you have severe belly pain, vomiting, fever, rectal bleeding, a swollen belly, or you cannot pass gas, don't wait. Seek urgent medical care. Now let's talk about what you should do before it gets worse. To understand why stool gets stuck, you need to understand how your bowel normally works. After you eat, food moves through your stomach and small intestine. Then it enters the large intestine, also called the colon. The colon's job is to absorb water and turn waste into stool. As stool moves through the colon, it becomes more solid. Eventually, it reaches the rectum, which is the final storage area before a bowel movement. When stool reaches the rectum, nerves send a signal to your brain. It's time to go. But if stool stays in the colon or rectum for too long, the body keeps absorbing water from it. The longer it sits there, the drier and harder it becomes. Over time, it can become so firm that it is difficult or even impossible to pass normally. That is when people say, "My stool is stuck." In medical terms, when a large, dry, hard piece of stool gets trapped in the rectum or colon, it may be called fecal impaction. This is usually a more serious form of constipation. Now, here's the mistake many people make. They think, if I just push harder, it will come out, but the rectum is sensitive. The tissues around the anus and rectum can tear, swell, or bleed if you strain too much. Strong pushing can also worsen hemorrhoids, cause sharp pain, and in some people, even make them dizzy or faint. So the goal is not to fight your body. The goal is to help the stool become softer, help the muscles relax, improve bowel movement, and know when the situation needs a doctor. Another confusing sign is watery leakage. Some people have a hard stool stuck inside, but watery stool leaks around it. They may think they have diarrhea, but sometimes this can happen when hard stool is blocking the normal path, and liquid passes around the blockage. That is why taking anti-diarrhea medicine without understanding the cause can sometimes make things worse. So if stool feels stuck, don't panic, don't force, and don't try random internet tricks. First, understand the warning signs, then take safe steps. Stool can get stuck for many reasons, and most of them build up slowly. One of the most common causes is dehydration. When your body does not have enough water, your colon pulls more water out of the stool. The stool becomes dry, hard, and difficult to pass. Another common cause is a low-fiber diet. Fiber helps add bulk and softness to stool. If your diet is low in fruits, vegetables, beans, lentils, oats, whole grains, and other fiber-rich foods, your bowel movements may become slower and harder. But there is an important warning here. If you suddenly eat a huge amount of fiber without drinking enough water, constipation can feel worse. You may get bloating, gas, and more pressure. Fiber works best when it is increased slowly and combined with enough fluids. A third cause is lack of movement. If you sit most of the day, stay in bed for long periods, or do not walk much, your intestines may also slow down. Movement helps stimulate the natural motion of the bowel. Another cause is ignoring the urge to go. When your body says, "Go to the bathroom," and you keep delaying it, stool stays in the rectum longer. The longer it stays there, the harder it becomes. Over time, this can train your body to send weaker signals, making constipation more frequent. Medications can also play a big role. Some pain medicines, especially opioids, can slow the bowel. Iron supplements, some antidepressants, certain allergy medicines, some antacids, and some blood pressure medicines may also contribute to constipation. If your constipation started after a new medication, speak with a doctor or pharmacist. Some people are also at higher risk. Older adults, pregnant women, people with diabetes, thyroid problems, neurological conditions, limited mobility, or long-term bed rest may be more likely to develop severe constipation or fecal impaction. Now comes the important part. How do you know if this is mild constipation or something more serious? Mild constipation may cause hard stool, straining, and discomfort, but you can still pass gas, you do not have severe belly pain, you are not vomiting, you do not have fever, and there is no significant bleeding. But if stool feels stuck and you also have severe abdominal pain, vomiting, fever, black stool, rectal bleeding, a swollen belly, unexplained weight loss, or you cannot pass gas, these are warning signs. In those situations, Do not rely on home remedies. Get medical help urgently. And if the person is elderly, pregnant, a child, or has serious health conditions, it is better to be extra careful. Now let's talk about what you can safely do if stool feels stuck and there are no emergency warning signs. The first step is simple. Stop forceful pushing. If you have been sitting on the toilet for several minutes, pushing hard, and nothing is coming out, take a break. Do not keep fighting. Straining for too long can increase swelling, pain, bleeding, and hemorrhoid irritation. Stand up. Walk slowly. Take deep breaths. Let your body relax. The second step is to improve your toilet posture. Place your feet on a small stool or support so your knees are slightly higher than your hips. Lean forward a little. Rest your elbows on your thighs. Relax your belly and breathe slowly. This position can help straighten the angle between the rectum and anus, making it easier for stool to pass. But remember, posture helps. It is not magic. If stool is truly impacted, posture alone may not solve it. The third step is hydration. Drink water if you can. Warm fluids such as warm water, tea, or soup may help some people stimulate a bowel movement. But if you are vomiting, severely bloated, or suspect a bowel blockage, do not force fluids. Get medical help. The fourth step is gentle movement. A slow 10 to 20-minute walk can help stimulate bowel activity. Light stretching may also help. Staying still for long periods can make constipation worse. The fifth step is to think about fiber the right way. For long-term prevention, fiber is very helpful. Foods like prunes, pears, apples, oats, vegetables, lentils, beans, and whole grains can support softer and more regular stools. But if stool already feels stuck, do not suddenly eat a mountain of fiber and expect instant relief. Too much fiber too fast can cause gas and bloating. Increase fiber gradually and drink enough water. The sixth step is to ask a pharmacist or doctor about safe options. Some over-the-counter stool softeners, osmotic laxatives, or suppositories may help certain people. But the safest option depends on your age, health conditions, symptoms, and medications. If you have kidney disease, heart disease, pregnancy, severe abdominal pain, vomiting, or you are treating a child or elderly person, speak with a healthcare professional before using laxatives. Do not overdose on laxatives. Taking more does not always mean faster relief. It can cause cramps, dehydration, weakness, and electrolyte problems. The seventh step is to avoid unsafe tricks. Do not insert sharp objects, tools, or random items into the rectum. Do not repeatedly dig or force stool out with your fingers. This can cause tears, bleeding, infection, and serious injury. If stool must be removed manually, that should be done by a trained healthcare professional in a safe medical setting. The eighth step is a warm bath. A warm bath or sitz bath may help relax the muscles around the anus and rectum, especially if there is pain or spasm. This may make it easier to relax and reduce discomfort. But again, this is supportive. It is not a cure for a serious blockage. So when should you call a doctor? If constipation lasts several days, stool feels stuck, pain is increasing, or safe home steps are not helping, contact a doctor. A doctor can examine you, identify the cause, and recommend the right treatment. And if you have severe belly pain, vomiting, fever, rectal bleeding, black stool, a swollen belly, or you cannot pass gas, seek urgent care. Now let's talk about why waiting too long can make this problem worse. When stool stays stuck in the rectum, it can become harder and drier. The rectum may stretch. The nerves may become less sensitive. Over time, your body may stop giving you strong signals that you need to go. This can create a painful cycle. First, you get constipated. Then, passing stool becomes painful. Because it hurts, you avoid going to the bathroom. The stool stays inside longer. It becomes harder. The next bowel movement hurts even more, so you avoid it again. That cycle can continue for days, weeks, or even longer. This is especially common in people who have hemorrhoids, anal fissures, fear of pain, low fluid intake, low fiber intake, or a habit of delaying bowel movements. Breaking the cycle is important. One helpful habit is creating a regular bowel routine. Try using the bathroom at the same time each day, especially after breakfast. Eating can naturally stimulate the colon to move. This is called the gastrocolic reflex. Do not sit on the toilet for 30 minutes scrolling on your phone. Long sitting can worsen hemorrhoids and create more pressure. Try for a short, relaxed period. If nothing happens, get up and try again later. Daily habits matter. Drink enough fluids, eat regular meals, increase fiber gradually, move your body. Do not ignore the urge to go. Give yourself time in the bathroom without rushing. But prevention does not mean ignoring warning signs. If your bowel habits suddenly change, If stool becomes very thin, if you see blood, if you have unexplained weight loss, or if constipation starts suddenly after age 45, you should speak with a doctor. Sometimes constipation is simple, but sometimes it is a sign of something that needs evaluation. Now imagine this situation. A person feels stool stuck. They panic. They push harder. Pain increases, a little blood appears, they become scared, then they take too much laxative, cramps begin, but the hard stool is still stuck. At that point, the best decision is not to keep guessing. The best decision is to get help. Doctors see this problem all the time. There is no need to feel ashamed. Your digestive system is part of your body, just like your heart, lungs, skin, or eyes. The earlier you get the right help, the easier it is to prevent complications. Let's put everything into a clear action plan. If stool feels stuck in the rectum, first check for warning signs. Do you have severe belly pain, vomiting, fever, rectal bleeding, black stool, a swollen belly? Are you unable to pass gas? If yes, do not wait. Seek urgent medical care. If there are no warning signs, stop forceful pushing. Take a break from the toilet, walk slowly, breathe deeply. Try a better toilet posture with your knees slightly higher than your hips. Drink fluids if you are able. Consider warm fluids. Try gentle movement. A warm bath may help relax the area. For long-term prevention, build a better bowel routine. Add fiber gradually. Drink enough water. Move daily. Do not ignore the urge to go. Review your medications with a doctor or pharmacist if constipation started recently or keeps returning. If symptoms do not improve, if pain increases, or if constipation keeps coming back, speak with a doctor. Do not keep treating the same problem again and again without knowing the cause. And please remember, do not use unsafe tricks. Do not insert objects. Do not force. Do not overdose on laxatives. These can turn a painful problem into a dangerous one. Stool stuck in the rectum can feel embarrassing, but it is a real medical issue. It deserves calm, safe, and serious attention. The key message is simple. Do not force it. Do not ignore red flags. Do not be ashamed to ask for help, because the sooner you handle it the right way, the easier it is to stop it from getting worse.